Hi all, this is Mridula. I'm studying second year BSc Physical Education in Madras Christian College. Today I have made this video with the topic of pectoralis major muscle. So on the next slide, I'm going to show a 3D video of pectoralis major muscle. So please have a look at it. This is the pectoralis major muscle. The red one, the red color muscle, the red color part is the pectoralis major muscle. So now let us look at what is pectoralis major. The pectoralis major is the superior most and largest muscle of the anterior chest wall. It is thick fan-shaped muscle that lies underneath the breast tissue and forms the anterior wall of the axilla. Pectoralis major is the most superficial muscle in the pectoral region. There are two heads of pectoral major. The first one is the clavicular region and the second is the sternocostal. The pectoralis major is active in deep or forced inspiration but not in expiration. So the sum of the actions that are involving pectoralis major is the adduction, horizontal adduction, and internal rotation. Now let us see about the origin of the pectoralis major muscle. The pectoralis major consists of two heads, the clavicular and the sternocostal head. Clavicular head originates from the anterior surface of the medial half of clavicle. Sternocostal head is the larger of the two heads and originates from the anterior surface of the manubrium and the body of sternum, the anterior surface of the superior six costal cartilages. So this is the clavicular portion or the clavicular head. This is the sternocostal portion. So this is the sternum and this is the clavicle region. So this one is the deltoid region. So this is the now let us see about the insertion. The upper and lower fibers of pectoralis major insert to the crest of greatest tuber of the humerus. Upper fibers are more anterior and caudal on the crest, while posterior fibers twist on themselves and are more posterior and cranial than the upper fibers. The crest of the greater tuber forms the lateral lip of the bicipital groove and is the site for insertion in pectoralis major. So now let us see the nerve supply and the arterial supply of pectoralis major. The two heads of the pectoral major have different nervous supplies. The clavicular head derives its nerve supply from the lateral pectoral nerve. The lateral pectoral nerve arises directly from the lateral cord of the branchial plexus. The medial pectoral nerve intervenes the sternocostal head. The medial pectoral nerve arrives from the medial cord. Modified radical mastectomy, breast reconstruction following mastectomy, and breast augmentation can pose risk to the nervous supply of the pectoralis major. Damage to the nerve can result in denervation and atrophy or fibrosis to section of pectoralis major. So this is the lateral pectoral nerve, which is arriving from the lateral cord, and this is the medial pectoral nerve, which is arriving from the medial cord. So now let us see at the functions. The function of the pectoralis major is threefold and dependent on which heads of muscle are involved. With the origin fixed, the pectoralis major adducts medially rotates and transversely adducts arm to glenohumeral joint. It assists in flexion of the arm. It assists in extension of the arm. It depresses the shoulder girdle at acromioclavicular and sternoclavicular joints. With the insertion fixed, it may assist in elevating thorax. As in forced inspiration, it is considered as an accessory muscle of inspiration. In crutch walking or parallel bar work, it is assist it will assist in supporting the weight of the body. So, so this is the glenohumeral joint and the acromioclavicular joint. So this is the crutch walk picture of a crutch walking, and these are the some example of parallel bar workouts. So cognital abnormalities. Cognital abnormalities of a pectoral muscle can be seen in Poland syndrome. Poland syndrome. This is characterized by the unilateral absence of the pectoralis major, usually occurring alongside ipsilateral and the other malformations of the chest wall. Poland syndrome can, on occasions, coexist with Moebius syndrome, occurring. So, Moebius syndrome is nothing but excess uh, muscle on the face or any part of the body, excess muscle on the face region. So now let us look at the exercises. So I have divided this into three parts: stretches, exercises, and postures. Good posture and bad. Even we'll see about the good postures and the bad postures of the body. So tips for your success: breathe comfortably and maintain a good posture throughout the exercise. Engage the muscles of your abdomen throughout the exercise to assist with posture and protect the back. So now let us see about the stretches. First one, the basic one is to hold each stretch for about 15 to 60 seconds and repeat it 2 to 4 times according to your physician's recommendation. The first one is wall stretch. Place a hand on the wall, elbows slightly bent or straight, turn body away from the wall, repeat it on the opposite side. Foam roller coaster chest, foam roller chest stretch. Lay on foam roller, relax shoulders and arm out your side. The third one is the chest opener. Clasp hands behind your back. Squeeze shoulder blades together. For additional stretch, lift hands of the back. Lift hands of back. Walk up the wall. Start with your hand at shoulder height and gradually walk your hand up the wall until you feel a stretch. Repeat on the opposite side. So now let us go to the stretches. Start with one set of 10. Gradually increase it to 2 to 3 sets of 10 with a short rest in between the sets. Okay. First one is the push-up. Wall, knee are standard. Place hands at shoulder height. Squeeze shoulder blades together. Maintain a neutral back. Gradually lower your chest. Then push back to up to starting position. So this can be done in the knee with your help of your knee. And these two postures can be done with the wall and it is standard. You can do this push-up with 3 kinds of moves. The second one is seated tube press. Start with elbows bent to 90 degrees and squish shoulder blades together. Then press arms out in front of you to shoulder height. The third one is chest fly with dumbbell. Start with arms straight out in front of you and slowly lower your arms out to your side. Then return to the starting position. So now let us look at the posture. Are we maintaining a good posture of our body? Let us see the do's and don'ts of the posture. Practice the safe postures. Maintain upright posture. Keep your ears directly over your shoulders. Use a chin tuck. Use a chin tuck. Keep your shoulders away from your ears. The don'ts are chest out in military posture, forward head posture, slouch, preaching on front of chair away from the seat back. So these are some of the these two are the do's and these are the don'ts of your don'ts of your posture that will make your back so bad to look. So thank you. This is all about the pectoral major muscle that we have seen today.